All right, we're at Perfect Care, our 3rd anniversary. Here's the outside of our building. Our tours are just getting started, so we're gonna go in. We're at King and Northwest Boulevard. Dr. Cohn and Dr. Higley. And some cat sculptures on our way in, and we're in the lobby. There we have planters out there usually. It's nice and bright with some color. And we have Hill's products available. And purple counters. There's Tina. A bunch of refreshments today. And some cat enrichment toys. And greenies and treats. And some feel away. Nice bright furniture. Making a video. And a video of a dental cleaning. And coffee bean counter here, so there's free coffee for the clients, and then we have some cool coffee beans on the counter. And some water, and a very cool picture.
Alright, thank you. Yeah, no problem.
And we're on a tour. Here's the restroom right here. Pretty exciting stuff. All of our rooms are in different colors. Oh, giving a tour here.
Hi. This is our exam room, which exhibits our Digitherm camera program.
Oh my gosh, I've bolted this to the wall, but I've never seen it actually work. Is this the top back of a cat?
Yeah, so that's looking straight down at a cat's back.
And what does the red represent? Just illness or pain?
So red is going to represent hot spots on the cat's body, which is typically indicative of inflammation, which can be caused by a multitude of things, which aren't very good for kitties.
Oh.
So it gives us a chance to kind of examine the cat without, hurting them or touching them first.
There's labels everywhere, and you guys did such an awesome job.
That was Zach.
She's such nice writing.
Yeah. Just in case you didn't know what a baby changing table was.
I like the new baby changing tables. The
too.
bottom on there is awesome.
Yeah, so the scale's not usually in there, and ever since we got them, on multiple occasions, Dr. Cohn's done exams down there. The cats just feel a lot more comfortable in there. It's kind of like a little hidey hole.
Oh, it came with gloves?
Yeah, so because cats are so, anything is so sensitive to heat, even us just handling the cat can change the heat patterns on the cat, which could, read as like a false alarm. So it came with gloves so that we can hold the cat properly without transferring heat from our hands.
I've always assumed these two things were identical, but one's for the eyes and one's for the ears.
Yep.
Bean loves playing with these cones. I need to take some used cones home. Thank you.
Of course.
Another exam room, baby changing table, and then this one has a little wave on the floor for him to be able to get into. And some pretty cool artwork, nice and bright. And then each room has a matching chairs, and put a chain up here. You can put IVs. And then lights, but a little bit of privacy. A pink room, very similar to the other rooms. I'm making a video. I've got somebody that can't come today, so I was walking through.
Alright. We have our therapy laser here, which is a good treatment that we can use on cats that have chronic pain or wounds that we're trying to get to heal, nerve injuries, things like that. And so you can see really good results with it, and it's a nice little stress treatment for our kitties that have those conditions.
And the cat has to wear glasses when you do it?
They do have to wear eye protection, so we have our little cat goggles on.
That's hilarious.
Yeah.
Thank you. Our break room, Dr. Cohen's office. We're making cat toys. This is our boarding room. I'm making a video. I've got somebody that can't come today, so I was gonna make a video. Squirt. Hi, Squirt. Nice meeting you. You look like my old cat, Kit Kat.
CG remembers you.
Oh, baby. Oh my goodness, you're so vicious. No, I know. You're very vicious too. And then we can make cat toys today. And then we have bird feeders outside. And there is King Boulevard at 614 Cycle. Yeah, really good hot dogs place. And then we got another killer over here, Hazel. Hazel is deadly. Oh my goodness, I know. Don't put your hands in there, you might get bit. Oh my goodness, what a sweetie. And then we have Henry over here. Hi, Henry. I see you. Hey, Henry. Oh my goodness, give me that paw. I heard you were very soft, but I haven't gotten to pet you yet. Oh, I know, you're a very soft baby. Very nice. And then we have a TV in here. The cats really like. We put them on sleep timer, so because they have to go to bed. And then we keep track of who's in the room. And then we have these large bins under here where we can put all the cat's personal supplies, so we can keep everything straight. I know, we're very talkative. And still on the tour. We have isolation room. So if we have a cat that may have fleas or ringworm or infectious, and then it vents outside, and then we have our own area where we can wash up before we go to help any other patients. I'm making a video. Tell me about this room, please.
Oh, me?
Yeah.
Hello. This is our surgery suite, and here we have an example of what would be one of our instrument packs. We have some instruments and gauze, and then we normally have it wrapped in this little draped cloth thing and set on the table for the surgeon to easily reach over and use. And then here we have our little warming pad to keep the patient warm during surgery, because sometimes they can get a little cold. And then normally we have a bunch of stuff hooked up to them, more than just the blood pressure cuff. We measure things like their oxygenation levels, their heart rate, blood pressure, things like that. And right now we have a demo up, but this is kind of like an example of values we would have during surgery. And then here we have the actual anesthesia machine. As you can see, it's not hooked up to our patient. And then we have the IV machine. So we normally would have like a bag of fluids here and a line running through and then connecting to the patient, and then the machine regulates how much volume of fluid the patient gets within a certain amount of time. And then here we have our cabinet that has suture and then other instrument packs, and then any other tools the doctor might need, and drapes. And then our last thing in here is our laser. So the doctors will use that to kind of cauterize vessels and seal off nerves. It works really quickly, and then it also, because it doesn't involve like a long process having to like ligate vessels and stuff like that, it kind of promotes a more painless healing process.
Thank you.
So yeah, no problem.
Thank you. Oh, are you doing X-ray and ultrasound?
I am.
Oh, I was gonna make a video for somebody that can't come today, so.
This is X-ray and ultrasound. We do a variety of different. We check for a variety of different things. So for the X-ray, we would check. We can do chest X-rays and abdominal X-rays. We also do if the cat is having any kind of arthritis or any pain in the limbs, we can also check for that. We can do limb X-rays. I have an X-ray up of a pregnant cat right now.
Oh.
And there's some babies.
Okay, where's the baby?
So there's a skull right
Oh my
here,
gosh.
and then he kind of curves around, and you can see his little tail. And then the other skull right there, there were two.
Two babies?
Mhm.
Oh my goodness.
And then we also do ultrasounds and echocardiograms. We have a echocardiogram up right now, so that's an image of the heart beating. And we would also do abdominal ultrasounds, checking for any kind of abnormalities. We also check to see if there's any enlarged lymph nodes, and we also check for make sure all the organs look right and are the right size. Dr. Cohn and Dr. Haley can measure each thing to make sure that they're around the right size, and especially with our GI kitties, if they're we're checking to see if they have any kind of gastrointestinal disease, then we can measure their intestines to make sure they're not thickened.
Nice.
And then Courtney has made this fun and it's
Mobile for the
Mobile,
cats to
thank you.
look at.
And so it's a good distraction for the kitties. It's really cute.
Thank you very much.
Yeah.
This is awesome. Can you tell me about this area, Dr. Cohen?
Of course. So this is our treatment room, and so a lot of different things go on in here. Over on this counter is where we take care of our surgical instruments. So we have our ultrasonic cleaner that we put our instruments in first to get rid of blood and dirt particles from the instruments. And then they're wrapped into a paper pack like this. And then they're put in the autoclave, which sterilizes the instruments. We put this tape on the pack, which before it goes into the autoclave, you can only see the outlines of the stripes on the tape. But after it comes out, those stripes are really dark. And that's how we know that it was actually sterilized.
Pretty magical.
And this is our setup for how things would look if we were doing a dental cleaning on a kitty. So this is our dental machine. So we have an ultrasonic scaler, a polisher, and a drill. These are some of the hand instruments that we might need to use during a dental cleaning. This is the anesthesia machine, and we would have this tube down the kitty's trachea so that the oxygen and gas would be going into the cat's lungs and keeping them safely asleep. We have our IV fluid pump that would be pumping fluids into the cat to help with blood pressure. And then back there is that yellow thing, that is our Doppler. So that has a cuff that goes around the cat's leg and then helps us measure blood pressure and heart rate. And this is our hot dog warming pad, so that helps to keep the kitty's temperature up during anesthesia, helps to keep them from getting too cold. This is our dental x-ray machine. And so we take full mouth x-rays on every kitty, and sometimes we'll see things like this where this tooth is basically resorbing or eating itself away, and that tooth is going to need to be extracted.
Very cool.
These cages have the heated floor, so this is where they would wake up from anesthesia, and it's nice and warm, so it helps to get their body temperature back up to normal more quickly.
Thank you.
All right, I will turn you over to Zach.
Oh, Zach.
So over here, we have our full in-house laboratory, which gives us the capability to be able to run blood work within 15 minutes or less. So pretty much when we have those cats that come in and they're super sick, they're vomiting, they haven't been eating for the past 3 or 4 days, and we need results kind of right now. We get some blood from them, we run it through our machines, that kicks back some results as far as like organ functioning, their white blood cells, their red blood cells, platelet function, all that fun stuff, and we can kind of help narrow down to like maybe their liver is what's causing them these issues, maybe it's kidney functioning, pancreatitis. These are a lot of things that we can kind of diagnose in our in-house lab. We don't have to wait for blood work results the next day. A lot of times that's what our doctors will usually do, just because for cost-wise, it's a little bit more beneficial to send it out, but in those urgent cases, we definitely need to run it in-house. So some of our machines that are here are the exact same machines that the IDEXX people use in their actual laboratories when we do send out that blood work, so we have very high confidence in these accuracy and results. Over here on our picture right here is actually one of our cases that we had from a urine sample. There's a lot of red, these little gray circles are what's called red blood cells, and then the kind of larger white circles are the white blood cells. And then it's a little bit easier to see when you switch over the color with the contrast. Some of these rod-looking things, those are bacteria. So this cat definitely had some sort of UTI going on, and we were able to send them home with antibiotics that day to kind of help clear that up. So we're able to read these urines a lot quicker. We're able to get these results a lot faster, and we're able to help out these kittens a lot quicker. If our machines ever kick back results as far as the white blood cells go, if something's abnormal and says, hey, you guys should probably check out something that's going on in their blood, we have the capabilities with our microscope to be able to do what's called a blood smear. And basically we look at their white blood cells just to make sure that the machine is kicking everything back accurately, and if there's anything else that we need to further diagnose, or if there's anything else that we need to change as far as our treatment plan. So this is...
You think it'll work? You think I can put
I
it
think
in?
it might be able to, if you get it.
Line this up.
Yeah.
Oh,
Kind of. Yeah. I used to be able to.
It's operator. Oh, I lost something. No, I think I'm failing. No.
Here.
close. There it is. Woohoo! There it is. Oh my gosh, you did it. It's so sensitive. What is that?
So, if I can.
It's so delicate.
So the thing to the right is what's called a segmented neutrophil, and those are part of your immune system that kicks up antibodies and kind of helps fight off common infections or things that the body is already aware of and kind of already knows how to fight off. And the thing to the left is what's called a monocyte, and those are another part of your immune system that kind of helps fight against infections. Those are the things that will engulf foreign material or things that need to be destroyed within the body, and will kind of, those are the main ones that take care of that.
That's very information.
Yeah.
Very cool. This is so good. And we're back to reception here. Here we are. All right. Hi, Courtney.